Do you frequently feel like your heart aches sometimes? Or maybe you've been extremely tired, even after a full night's sleep. What if you noticed your belly getting bigger, not from eating, but because something's going on inside? These signs might seem unrelated, but for some people, they point to a rare condition called Multicentric Castleman disease, or MCD. MCD isn't cancer, but it acts a bit like one. It causes your immune system to go haywire, making your lymph nodes swell up in many parts of your body. Imagine your lymph nodes as tiny security guards that fight germs. In MCD, these guards get confused and start shouting intruder even when there's no real threat, causing swelling, fever, and fatigue. It's rare, but when it happens, it needs serious attention. So what causes this confusion in the body's security system? The main suspect is a virus called HHV-8 human herpes virus, 8 especially in people who have weakened immune systems like those with HIV. Think of HHV-8 as a sneaky hacker that breaks into your body's command center and starts sending fake alarm signals. This tricks the immune system into overreacting, leading to MCD. But not everyone with MCD has HHV-8. In those cases, doctors believe the body itself starts producing too much of a protein called IL-6 interleukin 6, which acts like a megaphone telling immune cells to work nonstop. It's like leaving your car engine running 24/7. It eventually wears out. Genetics and other hidden infections might also play small roles, but scientists are still piecing that puzzle together. How do you know if you or someone you care about might have MCD? Let's play a quick game. Raise your hand if you've had unexplained fevers that come and go. How about sudden weight loss without trying? Or feeling so weak that even walking to the mailbox feels like a workout? Add swollen lymph nodes in your neck, underarms, or groin, like small, painless lumps under the skin, and it's time to talk to a doctor. Some people also get night sweats so bad they need to change clothes while sleeping, or a bloated belly due to swollen organs. These aren't just one-off issues, they keep coming back. That's what makes MCD tricky. It mimics flu, infections, or even cancer. But unlike the flu, it doesn't go away on its own. Diagnosing MCD is like being a medical detective. Doctors need more than symptoms, they need proof. First, they might do a lymph node biopsy, removing a tiny piece of a swollen node to look at under a microscope. Imagine zooming in on a crowd of cells and seeing them in total chaos, some too big, some growing like crazy. That's a clue. Blood tests also help. They can show high IL-6 levels or signs of inflammation. Scans like CT or PET show where else the nodes are swollen. Now for treatment. If HHV-8 is the culprit, antiviral drugs might help. But the real game changer is targeting IL-6. There's a drug called siltuximab that acts like a mute button for IL-6, calming the immune system. For others, chemotherapy or immune-modulating drugs work like a reset button. It's not a cure for everyone, but it can bring life back to normal. Can you prevent MCD? Right now, there's no vaccine or surefire way to avoid it because we don't fully understand all the triggers. But you can lower your risk by protecting your immune system. If you're at risk for HIV, use protection and get tested, since HIV increases your chances of HHV-8-related MCD. Stay up to date on health checkups. Think of it like car maintenance. You don't wait for the engine light to blink red. Regular blood work might catch odd signs early. And if you have unexplained symptoms that won't go away, speak up. Early diagnosis means earlier treatment, which can make a huge difference. Science is making progress. Recently, researchers discovered new drugs that target different parts of the immune overreaction in MCD. One called bortezomib blocks signals that tell cells to grow out of control. Another breakthrough is learning how MCD links to other diseases like POEMS syndrome and autoimmune disorders, helping doctors treat patients more precisely. Clinical trials are testing gene therapy and smarter antibodies. Imagine a future where a simple shot can reprogram your immune system to stop the chaos. It's not here yet, but every year we get closer. Patients are also helping by sharing their stories online, forming support groups